And a lot of what RTM is, at least the initial setup and things like that, are tasks that are being completed by clinicians every day. What are some of the ways that remote therapeutic monitoring, or RTM, can improve patient care, outcomes, and put a little bit of money into clinicians' pockets? Well, I think the answer to this question, obviously, on the money side, the billing side, it allows you to capture more billable time, right? A lot of these codes and a lot of what RTM is, at least the initial setup and things like that, are tasks that are being completed by clinicians every day. So, for the most part, I don't know about you, the clinic that I own and operate and the ones that I've consulted with, the clinicians go in and we have a platform already that allows for secure messaging. It allows for sending of like a home program or um, a home care platform that the patient can log into from home. They can see videos if there's exercise involved. They can read information about their diagnosis, their issues, whatever's going on. Provide some precautions around post-surgical care and things of that nature. So we're already doing that every day when the patient comes into the clinic, right? They're coming in, they're getting set up, they're getting logged in, they're accessing the system. So we're already doing the work. We're just not billing for it. So that's an easy sell, right? So it is very easy for, on the business side of things, for there to be a real and calculable ROI for clinicians or clinic organizations that are you going to use or implement or considering implementing RTM in their practice. Let's put that aside. What does it do for patient care and specifically their outcomes? I'm not a researcher anymore. I don't work at the university anymore. However, one of the things we were very big about, and one of the things that I spent a lot of time talking about on the podcast, in the book, and there's a lot of research on the topic, is on that of patient engagement and what that means for and how that affects adherence to home programs or participation in particularly my specialty areas, orthopedic and musculoskeletal rehabilitation. So, what is patient engagement, or how does that affect adherence to and clinical outcomes in that area? And specifically for the MSK space, there's a lot of research out there that shows that if you have patients with a better clinical experience, or they have a better satisfaction, a higher satisfaction level leaving the clinic, they feel more engaged, they're more likely to show up to their follow-up appointments, they're more likely to adhere to their home programs that are issued by their therapists, then obviously that means that leads to better clinical outcomes. How does remote therapeutic monitoring come into play? Well, some of these platforms allow asynchronous communication. They allow push notifications through an app or something like that. Some of them even, gamify the rehab process. So all of those things help keep a patient or a client engaged in their course of care. Either whether it be providing the information they need or the nudge they need, the motivation they need to complete their exercises for the day or to follow their home program, or giving the patient access to a secure messaging feature that allows the patient to shoot a message to their clinician and say, hey, I'm having pain with this exercise, or I'm having pain with this. Now imagine if there's some kind of physiological monitoring component like edema management or pain or something like that, then it would be even higher, right? So those are just a couple of the simple ways that I see remote therapeutic monitoring helping to improve the clinical outcomes on the part of the patients that are receiving that care. One, it helps keep them engaged, and engagement leads to higher satisfaction, improved value perception of the therapy process, and all of that, which ultimately leads to better clinical outcomes. All right, that's all I've got for now.